increase in heroin-related deaths an urgent public health crisis. He is calling on all first responders to carry a life-saving drug for those who overdose on heroin. Matt Markham has been working on this story. He joins us now in the newsroom. Matt, many of them want this drug to be carried with them already, right?
That's the case, absolutely, Greg. It's something paramedics say can reverse the effects of a heroin overdose. It's called Narcan, Naloxone, some people call it. It's a nasal spray, and it's relatively easy to use, but the issue is who pays for it and who else may be able to get it.
It's definitely a worthwhile tool to have.
Paramedics with the Mohawk Ambulance Service all carry and are trained to use Narcan or Naloxone and have for several years. They don't keep track of how many calls specifically deal with heroin overdoses, but Mike Russo would say the number seems to be on the increase. As a result, he's hoping to have 180 employees trained on how to use Narcan, too.
Our EMT-Basics all have access to EpiPens for allergic reactions, Albuterol for people who are having trouble breathing. This is the next big thing that, so to speak, that EMTs are going to be able to do.
The United States Attorney General Monday said first responders should carry naloxone. Many will go as far as to call it a miracle drug, literally bringing those who overdose back from the edge of death.
It combines to the same receptors that opiate drugs combine with, and it competes against the drugs, reversing and sometimes completely negating the effects of the drugs.
Narcan could cost between $20 and $40, and that could add up given all the extra calls. Could it be possible that the federal government might be able to subsidize this in any way?
You know, there's a tough climate in Washington to just cut away at domestic programs, and so it would be a battle to make certain the resources are there. But obviously, you don't want to impact upon local government.
In New York, the push to get naloxone on ambulances is part of an overall push to increase access. Only 17 states allow naloxone to be distributed to the public. Could there be any state legislation to make Narcan more available to anyone?
I think that's where we're headed, and we have to be very careful and thoughtful of who would be those individuals that would have Narcan at their disposal. First responders makes perfect sense.
All right, well, the White House reports heroin overdose deaths increased 45% between 2006 and 10, and just last week, several New York lawmakers introduced bills to make naloxone more available to parents or addicts and to increase funding for prevention and recovery programs. Greg?